Have you noticed more adults around you being diagnosed with asthma just out of the blue? What if I told you that that respiratory issue might actually be a signal from the heart? In this episode, we're going to unravel the intriguing connection between adult-onset asthma and heart disease, and what you need to know to protect your heart. February is Heart Health Month. We are grateful to our sponsor, Vitality Health RX, and their heart health supplement, Cardio Protect. Please visit shopvrx.com for this amazing supplement that will help your heart. Hello and welcome to Feel Better, Feel Great podcast. This is episode 150. What's behind the rise in adult-onset asthma? The asthma-heart disease connection. In each episode, we dive into the wonders of holistic health and functional medicine to empower you with the knowledge you need to lead a healthier, happier life. I'm your host, Dr. Andrea McSwain. And if you're new to me, please like, subscribe, and click the bell for this channel, Dr. McSwain. Please also remember that the information provided in this podcast is for educational purposes only. Please seek the medical advice of your physician with questions you may have regarding a medical condition or health objectives, knowing that I could become your doctor. So if you're interested in receiving medical care from the Michigan Center for Holistic Medicine and me, Dr. McSwain, then please check out our website, micenterhm.com, for information on our cancer care program, our Lyme care program, and also our metabolic programs. So let me get into this topic about adult onset asthma. Let me set the stage for you. So first of all, the CDC says around 25 million Americans have asthma, and there's a growing number being diagnosed as adults. Nearly 1 in 12 people in the United States are affected by asthma, with adult onset cases rising significantly in recent years. This is important because there are many people that have come into my practice and said, I have new onset asthma. And I'm like, I don't really understand that because your bronchioles have developed. So a lot of times when you look at kids and how they grow out of things, it's important to understand the physiology in the development of the human, right? So when humans are tiny, they have different immune systems, right? They have, usually they're immature immune systems, they're immature organ systems, right? Their brains aren't fully developed. Their musculoskeletal system isn't developed. The joints have more space between the bones. All these things, right? Or epiphyseal plates, which are actually the space within the bones, and they don't close. And, that's why kids can take a lot of tumbles and they pop up and they're fine. And adults take a tumble and they're not fine. Kind of a random note. Also, today's my daughter's birthday, and so I have a little story about her being young. But I remember one time she was like 2, and she just took like a mudslide down the stairs, and it was like maybe 10 stairs, and I was just like in the moment, I was totally freaked out, and I just like went with her. And her little mudslide down, I don't know, these 10 stairs was a really big stairway and a really big platform at the bottom. So it wasn't super long either. And the stairs were pretty shallow in their height. And so she took this like mudslide down with her body. And then I took a mudslide down. And then she popped right up. And I kind of was achy for a few days because that was, rough on me. And so she just popped up, and I started noticing how sometimes she could just pop right up after she fell, and that's what little ones do. And that's what I think about asthma. Little ones have asthma because of an immature organ development, and then they mature, and then asthma dissipates. And we kind of know that. We kind of expect that when kids have asthma. They're going to grow out of it, right? So why do adults grow into it? Why are adults growing into asthma? And that is the question, right? Just because we're told something doesn't mean we have to believe it. We really need to think and create context in medicine. And a lot of medicine is physiology and understanding how things work. So why are adults getting asthma? It makes me really wonder because we already know that heart disease is the leading cause of death in the United States, with nearly 700,000 deaths related to heart disease in 2021. But we also know that there are studies that suggest that the respiratory system, like wheezing and shortness of breath, are often linked to undiagnosed heart disease. So again, I'm just going to say it flat out. If you are getting a message that you have adult onset asthma, you really need to be thinking about what's happening in your cardiovascular system, what is happening to your heart. Because up to 30% of adults diagnosed with asthma may actually have cardiac conditions contributing to their symptoms. Okay, so what is adult onset asthma? Okay, first of all, it's a persistent cough, wheezing, shortness of breath, and chest tightness. It can be triggered by allergies, environmental factors, inflammation. It can be exacerbated by weight. It can be exacerbated by shoulder pain. It can be exacerbated by liver dysfunction. It can be exacerbated by anything that affects the chest cavity. All right, GERD, right? So how does heart disease mimic asthma? Well, cardiac asthma, okay, so fluid can build up in the lungs due to the heart not pumping so well, and this can cause asthma-like symptoms. Also, high blood pressure in the lungs, okay, so that's a vascular issue, can lead to wheezing and breathlessness. Also, atrial fibrillation. So irregular heartbeats can result in fatigue and difficulty breathing. This is often mistaken for asthma. And another one of concern, and I'll talk about it in a later episode, is the risk for blood clots in the lungs, making it very difficult to breathe. So these are, very unobvious symptoms. We think it's asthma. I don't know why. It's your heart. To me, it's your heart until proven otherwise. And that's a little doctor way of saying, let's look at that because that's a much more significant concern. All right, so chronic inflammation is a shared pathway between asthma and heart disease. These are conditions like obesity, smoking, poor diet. I would also say not getting the heart pumping exacerbates both diseases. So let me tell you a little bit more from an osteopath perspective and a functional medicine perspective, right? I really see the heart. Okay, so first of all, the heart is encased in the lungs, and then the whole thing is encased in the rib cage. Below the heart and the lungs is the liver, and they all have a role to play to support each other. I just started thinking about this one day when it's like, why would the heart be completely surrounded by lung tissue? And a lot of what happens when the body works is if you have something by it, right, you're going to support the squeezing and the pumping element. So as an osteopath, I believe everything is about the pump, the inherent pump. And so this pumping idea of the heart supporting the lungs and the lungs supporting the heart, and then you have the liver as well as pumps. There's an element of movement, right? The blood vessels pump. We look at the aorta pumping, and all those things make a difference. In thinking about the pump, it's really important to understand how lifestyle plays into that, right? So again, everything for me is thinking about how the body serves as a pump. And so when you have obesity and the lungs get a little bit heavier because of the weight, when there's smoking and the lungs get a little bit tighter because of some fibrosity that goes on, the lungs get a little bit tighter if there's more fibrous tissue that develops in the lungs. And then obviously poor diet is just a lot about inflammation. And it's a lot about indigestion issues and the esophagus getting inflamed, which is also a tissue that is right by the lungs and the heart. And so when you have that kind of inflammation increasing, then there can be some problems of how chronic inflammation plays out in adult onset asthma / coronary artery disease or cardiovascular disease. All right, so I started kind of thinking about this some years ago when a patient came into my office and she had a lot of cardiac issues actually. And she had already had a heart attack by the age of like 45. And that's very unusual for women. She did smoke, she did use alcohol, and then all of a sudden it was like, oh, and I have asthma. It's like, you have adult onset asthma? So she really actually already had been acknowledged having some cardiovascular disease, but she had some new symptoms that were really impacting her daily life. of wheezing, difficulty breathing. She had obesity, and she didn't exercise. And then obviously, as I mentioned, there was some alcoholism. And in any case, being diagnosed with adult onset asthma made me really wonder. It's like, what are her lungs really doing here where the bronchioles or the upper airways are having the problem? I think the major issue here is the heart. And of course, it seemed like a distraction. She was given a lot of medications to abate asthma, a lot of corticosteroids, which are immune suppressive at high doses, and quite a few different options of corticosteroids. So inhalers and Symbicort and a bunch of those things. And then her heart disease continued to exacerbate. And I became very certain in that situation that those symptoms she was experiencing that were labeled adult onset asthma were much more reflective of her rapid decline in cardiovascular function. So make sure that if someone recommends that you do asthma testing, or if you have asthma symptoms, then if they're not improving, especially, that you need to be looking for comprehensive testing for your cardiometabolic system. Okay. And why, of course, does this misdiagnosis happen? Well, first of all, the symptoms overlap: shortness of breath, chest tightness, decreased, energy. So there's also kind of this acceptance of healthcare providers saying like, oh yeah, adult onset asthma, that's the new trend. And it's like, I don't know about that. And then there are important tools to use. You could look at EKGs, pulmonary function tests, and inflammation markers, okay? Because you are a whole system. So make sure that you advocate for thorough testing of your heart if you're diagnosed with adult onset asthma. And then monitor things that affect your heart, your blood pressure, your lipid levels, your inflammation levels, and your weight. And then, because also if your pump is not pumping very well, then your body is going to store more waste and it's going to store more fluid, and that is going to increase your weight. So obviously other tips to support lifestyle, because lifestyle helps reduce risk, or lifestyle helps increase risk. So look at lifestyle metrics that help you reduce risk. So there's anti-inflammatory diets that are primarily plant-based. Of course, with all of those, you would want good, healthy, plant-based fats. Looking at regular movement, okay? And I've discussed that in previous podcasts. And then avoiding triggers like smoking or poor air quality. And that one really hits home for me because of my mom and what she struggled with poor air quality that really caused ultimately her pulmonary embolism and her death. So those are pretty significant environmental triggers that affect our lungs, but also affect our heart. And that's a lot to think about, and I really want you to think about it. So I hope that you found insights valuable and you feel inspired to apply what you've learned today. There is an article from the National Institute of Health called Understanding the Link Between Adult Asthma and Coronary Artery Disease, and that will be available in our blog. So if this resonated with you, please subscribe to our podcast, leave a review, share it with friends and family who might benefit from this discussion, because adult onset asthma could be a red flag for underlying heart disease. Early detection and treatment saves lives. So if you or someone you know has recently been diagnosed with asthma as an adult, it's worth asking, could this be something more? Could this be my heart? Talk to your doctor and take charge of your health. Also, to help you take charge of your health is our free guide, Inflammation 101, a simple 3-day plan to reduce pain, boost immunity, and improve your health. That link is in the blog as well. We hope we get started today.